Human papillomavirus infection is caused by a DNA virus from the Papillomaviridae family. Many HPV infections cause no symptoms and 90% resolve spontaneously within 2 years. In some cases, an HPV infection persists and results in either warts or precancerous lesions. These lesions, depending on the site affected, increase the risk of cancer of the cervix, vulva, vagina, penis, anus, mouth, tonsils, or throat. Nearly all cervical cancer is due to HPV in two strains, HPV-16 and HPV-18, account for 70% of cases. HPV-16 is responsible for almost 90% of HPV-positive oropharyngeal cancers. Between 60% and 90% of the other cancers listed above are also linked to HPV. HPV-6 and HPV-11 are common causes of genital warts and laryngeal papillomatosis. An HPV infection is caused by human papillomavirus, a DNA virus from the papillomavirus family. Over 170 types have been described. An individual can become infected with more than one type of HPV, and the disease is only known to affect humans. More than 40 types may be spread through sexual contact and infect the anus and genitals. Risk factors for persistent infection by sexually transmitted types include early age of first sexual intercourse, multiple sexual partners, smoking, and poor immune function. These types are typically spread by sustained direct skin-to-skin contact, with vaginal and anal sex being the most common methods. HPV infection can also spread from a mother to baby during pregnancy. There is no evidence that HPV can spread via common items like toilet seats, but the types that cause warts may spread via surfaces such as floors. HPV is not killed by common hand sanitizers and disinfectants, increasing the possibility of the virus being transferred via non-living infectious agents called fomites. HPV vaccines can prevent the most common types of infection. To be most effective, inoculation should occur before the onset of sexual activity, and are therefore recommended between the ages of 9 to 13 years. Cervical cancer screening, such as the Papa Nicolau test, or examination of the cervix after applying acetic acid, can detect both early cancer and abnormal cells that may develop into cancer. Screening allows for early treatment which results in better outcomes. Screening has reduced both the number of cases and the number of deaths from cervical cancer. Genital warts can be removed by freezing. Nearly every individual is infected by HPV at some point in their lives. HPV is the most common sexually transmitted infection, globally. Worldwide in 2018, an estimated 569,000 new cases of cervical cancer occurred, with 311,000 deaths. Around 85% of these cervical cancers occurred in low and middle income countries. In the United States, about 30,700 cases of cancer due to HPV occur each year. Roughly 1% of sexually active adults have genital warts. Cases of skin warts have been described since the time of ancient Greece, but that they were caused by a virus was not determined until 1907.